A bunion is an unnatural bony hump that forms at the base of the big toe, where it attaches to the foot. We spoke with Dr. Aaron Bean of Desert Regional Medical Center in Palm Springs to learn how this condition develops and how it's typically treated.
So a bunion is actually a derangement of the joint in the foot, in the big toe joint. And you have tendons that are pulling the toe in an abnormal direction, and eventually those tendons contract and you end up with almost a permanent deformity in the foot. Most of the time when patients come to my office, it's one of two things. The joint itself, that bump is rubbing on the shoes. It makes wearing enclosed shoes difficult. And then a lot of times with that abnormal wear and tear, it's like having your tires on your car malaligned. You start to wear out the cartilage and actually develop arthritis on the inside of that joint. The foot actually starts to spread out, and if you were to measure the foot over a period of time, the foot actually becomes wider, and it makes wearing shoes difficult because the end of the shoe is much wider than the part around the heel, and so to get a shoe that fits adequately, the back of the shoe is loose, and the patients get very frustrated in finding adequate shoes. You can get a bunion on both feet. It's very common. I'd say probably about 75% of patients will have bunions on both feet. The other 25% can have a severe deformity on one foot, and the other foot is essentially normal. So usually when a patient takes the time out of their schedule, comes to our practice asking about what can be done for their bunion, we usually find that that's a surgical matter at that point. If it's difficult to find shoes that, like I said, it will conform to the deformity but also fit the back of the foot, with the surgical procedures we have nowadays, we can realign that bunion, we can straighten it out, and make wearing shoes much more comfortable. And so we usually recommend surgery at that point if a patient is coming to us asking for treatment. With bunion procedures, there's probably 20 or 30 surgical procedures. If you tailor the correct procedure to the patient, then it's very rare to have reoccurrence. If you use the same surgical procedure for every patient, then a lot of times our practice, we have a lot of patients where we do revisional bunion surgery where the wrong procedure was chosen. So tailoring the right procedure for the patient ensures a good long-term outcome to prevent it from coming back.
Dr. Bean talks about the success rate after bunion surgery.
Typically the first 2 to 3 days they're taking more pain medication to keep themselves comfortable, but within 2 to 3 weeks the pain is minimal, they're starting to walk again, and they recover pretty quickly. Typically we protect the patient in a shoe or boot for 6 weeks, and then we encourage them to do some home physical therapy where they do, just like the knee or hip, opening that joint up, preventing scar tissue. And in a small subset of patients, we'll send them for physical therapy where they can do ultrasound and some stretching exercises. We've progressed now where the implants that we use, whether it be a plate or a screw, we can be less invasive, which means less pain for the patient, better recovery, where a lot of the times, about 75% of the time, we'll allow the patients to walk 100% on that foot in a protective shoe or a boot, and recovery time is minimized and patients seem to have less pain. It used to be with these procedures, patients were in a cast, had much more pain and a longer recovery, to where we can offer these procedures with less recovery, less cost to the patient, and really a better outcome.